See, most of the times hypertension goes undetected in the society because even you have hypertension, blood pressure of 140, 190, you don't have symptoms. Patient does not have any kind of a symptom. They will have just some mild headache, sometimes some breathlessness, but they will not come to a doctor and say there is a blood pressure. And then once it goes into a kidney failure or heart failure or brain stroke, they will come to a doctor. So that whole spectrum of hypertension is undetected because we just don't know about it. Basically, what we are doing here is we are personalizing the blood pressure and personalizing the heart health. It is a very innovative concept. Very few people has done this. If you see, you treat hypertension, you treat heart disease, but no one has thought of personalizing them. Why it is important to personalize your heart disease and blood pressure is everybody is different genetically. Everybody's risk factor is different. Everybody's habits are different. Everybody's diet is different. So if you give one medication for everyone, that will not act. That may act for some time. It can control the blood pressure, it can control the heart disease, but it may not give them the long-lasting effect. Like they will go into a complications of heart failure, they will go into complication of renal failure or any other failures. So this is what I have done. I have personalized the blood pressure and I personalized the heart health. For anybody who comes here or anywhere in UAE, he can scan this scan code. Once you scan, you get the different questionnaires. There are 16 questions we have put into those questionnaires. And those 16 questions are right from your family history, habits, your diet, your stress level, the way you, what time you wake up, what time you sleep, and then your hypertension, heart disease, whether you have gone any heart angioplasty. So that will give us a 16 points. Out of that 16 points, less than 6 point patient does not need any kind of a treatment, just a lifestyle modification. From 6 to 12 points, patient will, we call them a patient. They are the pre-hypertension runners, and then we will treat them according to their blood pressure levels. And more than 12, it is a dangerous thing. Patient needs to be investigated. Patient needs to be treated for the hypertension. And that survey we will get. See, most of the times hypertension goes undetected in the society because even you have hypertension, blood pressure of 140, 190, you don't have symptoms. Patient does not have any kind of a symptom. They will have just some mild headache, sometimes some breathlessness, but they will not come to a doctor and say there is a blood pressure. And then once it goes into a kidney failure or heart failure or brain stroke, they will come to a doctor. So that whole spectrum of hypertension is undetected because we just don't know about it. So this survey will make us, for everyone, it will important to understand what is hypertension. And then after hypertension, once we go through this survey, then we'll get the reports. We have done 3 packages. If the score is less than 6, we will give them only diet and yoga advice. If the score is 6 to 12, we will do their ECG, hemoglobin, urea creatinine, and then diet and yoga therapy will be advising. And if the score is more than 12, we will get done all this investigation. We will get done ECG, echo, TMT, diet and yoga, and then we will advise them a treatment. So in the treatment package, how to personalize is one out of 32 blood pressure medicines. We will choose what is exactly important for the patient according to our survey. We will give them a right diet. We will give them the 10 minutes of the yoga session so that they can follow at home. And then we can follow up with them every 3 months. So this is whole hypertension is all about. And similarly for a heart disease. So this is what we are doing at the Zen Life. And mind it, this is the first time in Dubai somebody is personalizing the hypertension and personalizing the heart disease. And that we are starting at our clinic. We should be proud that we are starting something very, very new in Dubai. Nobody has done that. We will do this and then we will definitely make a difference in a preventive heart disease.